Well, greetings everybody, because I know it, depending on the part of the world you are joining us from, the times may differ. So greetings everybody and welcome to the preparatory workshop on the Global Drug Policy Index. Yes, the new anticipated resource tool that is yet to be launched to support our efforts as regards drug policy across the globe. So before we start this session, I would like to talk about a few ground rules, housekeeping rules that I would like all of us to take notice of. So yes, for the purposes of language facilitation, we have provided interpretation. There is interpretation service available, and so kindly look on your screen, below your screen, and click on the interpretation icon, that's the little globe, and then select your preferred language channel, and please stay on that channel. Also, I would also like to ask all participants to keep their microphones on mute and only unmute themselves when they have the floor to speak or they've been invited to speak. Additionally, I would also encourage us to use the hand raising feature on Zoom. If you have any questions or you want to seek permission to use the floor. Wherever you may be joining us from, also, I would like you to introduce yourself briefly in the chat box. And please mind you, the chat box will also be used to receive questions, suggestions, or whatever input that you may have. So I'll be keeping a very close eye on the chat box and reading out our questions. So if you have any questions, you can quickly and then easily type them out in the chat box for us. On this note, I would like to hand over to Jimmy to give us a few words from IDPC and an overview of the Global Drug Policy Index.
Thank you so much, Samuel, and hopefully everybody can hear me okay. It's my pleasure to be here today, and thank you to the West Africa Drug Policy Network for hosting this event today. My name is Jamie Bridge. I work with the International Drug Policy Consortium, IDPC. I'm based in the UK, the United Kingdom, and we are one of the lead partners delivering this new Global Drug Policy Index project, which we are very excited about and we're going to tell you about today. So just very briefly, today's event is going to cover a few areas. We're going to talk first about what is the Global Drug Policy Index and explain why we're doing this and why we think it's important. We're then going to talk a bit more in detail about the methodology and how we're doing the index and the methods that we're using. And then almost most importantly, at the end, Samuel and Maria are going to take you through a conversation about how do we use the index. Once we've created this tool, how can you use it in your national level advocacy? And I believe after the main presentations, there will then be breakout groups that focus on some of the target countries as well. So first of all, to talk about what the Global Drug Policy Index is. It's what's known as a composite index. And what that means is that you're taking data and taking information from lots and lots of different places, putting it all together into one kind of mixing pot in order to come up with a score or an outcome per country. Now, this is the first time, as far as we know, this is the first time that a composite index has been focused purely on drug policies. And that's really, for us, that's really where the excitement is. We're doing something that's never been done before. But there are already hundreds of other composite indexes that are used in other sectors and in other parts of work. So you may have heard of some of them. For example, there's the Human Rights Measurement Index, the Aid Transparency Index, the Fragile States Index, the Press Freedom Index, the Global Hunger Index, the Human Development Index, and many, many more. And all of these indexes have that same methodology. They all take data from lots of different places and put it together in order to create a score. So the key thing with an index is that we don't have the resources, we don't have the time or the money to do our own research. So what we're looking to do is to use information and data that is already out there, and to use that data, put it together to create this picture of what is happening in drug policies in different countries. So this data might come from existing databases, it might come from the United Nations, it might come from the information that governments have to report to the United Nations, it could come from other academic research that's been done, and as we'll talk about a bit later, a lot of that data also comes from civil society and from you as our partners in those countries. And it's really by using that range of different sources of data, that's one of the strengths of the composite index, such as this one. The aim at the end is that we have, for each country that we're looking at, we are giving them a score out of 100. And what we're saying with that score is that the higher, if you score 100 out of 100, which no country is going to score maximum points, but if you were to score maximum points, what that would mean is that your national drug policy is progressive, it's evidence-based, and crucially, it's aligned with the United Nations system common position on drugs. This is a document that was released in November 2018, and it really is designed to unite the entire United Nations system and to provide a guide on what a good drug policy should look like. And therefore, we're using that as our basis for this index. So if you score 100 out of 100, your drug policy in your country is perfectly aligned with the best practice, with the common position, with the evidence. If you score 0 out of 100, then you're the opposite. You have the worst drug policy imaginable. And as you can imagine, most countries are going to fall somewhere in the middle. And I think one of the benefits of doing this is that, in a way, one of the things that indexes do, they bring a scientific kind of rigor, and they have a lot of weighting because of their scientific basis. But at the same time, they're also politically, they're playing on national pride. And if your country is only scored 50 out of 100, it enables you to start having conversations, whether it's with politicians or in the media, about how can we get that score higher? How can we improve our rating? And we've seen this from other indexes, but they can have a really important effect in providing some impetus for change in the country. Because particularly if you've scored 50 out of 100, but your neighboring country has scored 70 out of 100, national pride is an important driver of it can create a lot of momentum when we're trying to change policies. And it's really that special advocacy power that we're hoping that this index will bring and support you and support your work. This is something that we've been talking about at IDPC and with some of our partners. We've been talking about the idea of an index for a long, long time now. So we're really excited to be able to say that we're actually going to launch this in a few months' time. So just quickly to explain where this has come from. The funding for this project is from the Robert Carr Fund for Civil Society Networks. They launched a call for proposals in 2019 that was asking for new and innovative ideas, things that had never been tried before. So as a consortium of different NGOs from around the world, including IDPC, also including the West Africa Drug Policy Network, and also including our academic partner, the Global Drug Policy Observatory, which is based at Swansea University. These organizations that you see on the slide, they form the Harm Reduction Consortium, and together we submitted this proposal to deliver the Drug Policy Index. So why are we doing this now? I mean, as I mentioned, we've been talking about doing this for a long time. And I'll be completely honest, one of the reasons that we're doing it now is that we managed to find the funding. You know, one of the biggest problems whenever we talked about it before is that, you know, this is a big project and it's a huge piece of work. And up until now, we've never been in a position where we could start it. But we're really thankful to the Robert Carr Fund for allowing us to start this project in 2021. But that's not the only reason. I mean, I would say that now more than ever, what we're seeing is that there's no global consensus on drugs. And the drug policies that are implemented in different countries, they now vary so widely. We have a situation where certain drugs are now completely legal in some countries, and yet the same drug can be, you know, using the same drug can be punished with the death penalty in other countries. So you couldn't have a bigger range. And in a way, one of the questions that the index is looking to answer is to capture those differences and to see the range of different policies that exist and to show that there is no consensus on drugs. And that whereas some countries have a very progressive approach, other countries have a very regressive, a very negative approach towards drugs. And that's going to be true globally. I'd imagine it's also going to be true even within Africa. You know, even if you look within African countries, the difference in policies and the difference in approaches is really noticeable. So that's what we're trying to capture with this piece of work. And we feel that now is the ideal time to do that. The other reason is that we already have UN data on drugs, global data on drugs. The United Nations Office on Drugs and Crime, every year they produce the World Drug Report, which they launch on the 26th of June. And, you know, that report has improved massively over the years and is now more comprehensive than it's ever been before. However, it's still reliant almost entirely on the data that governments submit. And for political reasons, the United Nations Office on Drugs and Crime, it's not really able to question that data, not properly. So if a government tells UNODC that they don't have drug use, or they have no drug users, or they have no injecting drug use, there's not enough scrutiny being applied, and there's just a reliance on that data that's being submitted. So again, that's one of the benefits of the index, is that we're not bound. We don't have to accept the data that a government submits. We have lots of different sources of data that we're going to be using in order to try and get the most accurate picture possible. And the main reason for doing this is that we really do believe that it will support and boost and provide an extra resource that will help your local advocacy. Most of you are on this call because you are advocating for drug policy reform or harm reduction at the national level. And we really hope that this index and the data from this index will support your work. I'm not going to sit here and pretend that the index on its own is going to fix all the problems, or is going to be the one thing that makes drug policies change in Morocco or Kenya or Ghana. But we do believe it will help. And we really think it will be a useful addition to the resources that you have available to do your work. So the project, as we've designed it, is an 18-month project, and it actually ends at the end of this year. So we're already more than a year into this project. But most of that time has been spent on this first phase, really important phase, which was designing the index. In order to do that, we've been talking to as many people as we could. We had several months where we had lots of workshops, meetings, consultations, all online, of course, because of COVID-19. But overall, we were able to meet with hundreds of people, including civil society experts and academic experts. Also, some of those people who work on the other indexes outside of drug policy, some of those other indexes that I mentioned earlier. And really, the whole purpose of that was to get as much information, as much perspective and lessons and experience as possible in order to shape the design of the index that we have now. And so obviously that took a long time, but that's something you only have to do once. So now that we've got the design, we can keep implementing this index in the future. And so in a way, we're now in this second stage, which is the data collection. A lot of the data is already being collected and analysed by our academic partner at Swansea University. And they'll also, there's also a civil society survey that has been launched, and I'll talk a bit more about that later. And then obviously, once we have the data available, we will be launching the index. And at the moment, that plan is to launch on Monday, the 8th of November. So, just around 2 months away from now, we will be launching the first set of data. Now, that launch will include a number of different things. There's going to be media press conferences, media features, and a press release that you can all use in your own countries as well. There's going to be the website, which I'll present a bit later, which will have all of the data available to you to use, and lots of other resources available for you as well. And there will also be a more narrative report, which IDPC is going to produce, which what we're going to try and do there is try to communicate the stories behind the data. So, for example, if Kenya scores 80 out of 100, let's tell the story about what's going on in Kenya and what still needs to change. So, they're the elements of the launch. And then there's a really important stage after that, which is something we want to talk with you today about, which is the action stage. So once we've launched it in November, we will then be supporting partners in the target countries to do something that uses that data in their advocacy. And as Maria will present later, that could be anything. It could be a governmental meeting. It could be a workshop, a webinar, a social media campaign. It's really up to you what you do. But we have resources available to support your work at the national level so that you can use the data that we produce and put it into action in your country. So with that, I'll hand over to Maria, who's going to just take us through some of the next slides. So over to you, Maria. And if you want to introduce yourself as well.
All right. Thank you, Jeremy. Good morning, everyone. Greetings, as Sami would say, because we are all from different parts of the world and probably the time zones are not the same. Hi.
Yes, we can hear you, Maria. We can hear you.
Is it better now? Okay.
Is it better now? Thank you so much. So I'm Maria Goretti, and I work with Jamie as the African representative for IDPC. It's great to be joining you for this very important project discussion. So as we've all heard Jamie giving us highlights of what the project is all about and what we seek to address or do in this project. So in a very ideal world, where we will have unlimited resources, unlimited time, thousands of team members working and collecting data, and then looking into hundreds and thousands of different indicators around every single issue around the world that relates to drugs and drug policy. But you will agree with me that we do not live in an ideal world, or we don't live in a dream world. And so we have to deal with the realities on the ground. So in reality, we had to at least narrow down some of the indicators so that we will be able to accomplish what we have to do. So what we did in this particular project is to narrow down the indicators to about 60 indicators, and that basically covers about 4 main dimensions we believe will reflect what we are trying to measure here in terms of the drug policy index. We will talk about these dimensions a bit later in the presentation. So, like I rightly indicated, if we had resources, we would have measured at least tens and thousands of these indicators that we needed to look into. And of course, so in doing this, we had to at least narrow this down and look at what is relevant to the topic, and also the data that is available that we will be able to collect. Because even if you have these indicators and you don't have data available to be able to collect and measure, then it wouldn't make sense. So because it's not good to have an indicator when the data is not available for most of the countries around the world, then it will not help us to be able to create at least the composite score that we are looking at in doing. And so, in fact, there were other difficult processes that we had to go through in order to arrive at what exactly we need to consider in the data collection process of this of this project. And you all agree with me that if we really have resources, what we'll be doing is to be collecting data from every single country. Not even every single country, every single state or county or region, depending on where you are coming from, and in terms of how your geographical location, divisions of regions are done. So that is what we would have been doing. But unfortunately, we are in realities, and of course, resources limitations will not allow us to be able to do that. So we could have done every single country if we had just at least 3 or 4 indicators. But here's the case, we are talking about 60 indicators. So of course, we need to ensure that we need to be able to combine these to be able to make a meaningful index and a meaningful score at the end of the day. So we had to balance this between the indicators and on one hand, and the country selection, the total number of countries we can cover on the other hand. And the balance we came out with was 60 indicators and 30 countries. So in terms of the countries, which countries are we looking at here in terms of this particular project? Now, the UNODC, that's the United Nations Office on Drugs and Crime, divides the world into 17 different sub-regions. And so we have made sure that we have done this selection of the countries from each of these sub-regions. Attempts have been made to try and make sure that we are able to select from each of these countries so that we are, of course, as we will be able to stay true to the title in the project, global, in terms of the project focus. So what you see here are the initial 30 countries that we selected. And like I said initially, because it's our goal that we want to, our goal to cover more other countries, we believe that as we go on with this project year by year, the ultimate ambition is to be able to grow and build the index at least to cover about 192 countries around the world. So for now, that is not possible as we stand in terms of the resources that are available for us to be able to do so. So of course, we have to start somewhere, and starting somewhere is the 30 countries that we are currently looking at in terms of working with. Now, so in terms of the African region, we have Kenya, Mozambique, and then Morocco, which is covering the entire Western Sahara, and then Mozambique. So we have about 4. So that's Kenya, Mozambique, Senegal, and that of Morocco, which covers the sub-Saharan, Western Sahara. Let me put it that way. So as you can see from the display, that is the countries. And of course, those who will love to see it more visibly on the map, as you can see, these are the countries, as you can see in the pink color. These are the countries that are covered in terms of the study. When you look at Morocco, you realize that there was an error in coloring the entire Western Sahara, which covers Morocco. So please pardon us if you are noticing that right now. So this is how it looks like. But you also realize that from this map, there are a lot of gaps. And like I rightly said much earlier, in a dream world, we would have loved, in an ideal world, we would have loved to cover a lot and lots of these countries, but we are limited by resources. And so, of course, we have to start with these initial 30 countries. And then as we grow the index, we are hopeful that we will be able to cover more and more other countries across the globe. On this note, I will want to now hand over to my colleague, Jamie, who will come in to take us through the design of the project, of the global project, the global index, drug policy index project. Jamie, so I want to hand over to you right now.
Thank you, Maria. So just a few slides quickly to talk about the design part, and then we'll have an opportunity for any questions at this first stage. So yeah, so the design, we put out a call for proposals to hire a company to help us with the design and how the whole thing is going to look. And so we've selected the logo, which you can see in the corner of the slides today, and a color scheme which you can see reflected in the slides as well. So the aim was to try and have something that looks very professional, very objective, but also, is engaging and is going to get people's attention. So that's kind of what we're working on, or what we've been working on in terms of the design. And the key, in a way, the main interface that people have with this project will be the interactive website. And I'll present a few slides later on that will show you what that website might look like. But in essence, that website is going to have, it's really going to be designed so that whatever level of detail you want to engage at, the website will allow you to do this. So, for example, if you only want to see the maps, if you only want to see the colorful graphics that show you the scores around the world, then those will be on the website. And as Maria says, we'll make sure that that we correct that error that we made around the Western Sahara and Morocco, on the map. There'll be maps available for those who just want to see the global picture. If you want to see the scores, the overall scores, that will be available to you, and you'll be able to sort that and analyze that. But also, if you only want to see the results for Kenya, if you only want to understand the data for South Africa, there will be country profile pages, which will also be downloadable resources for each of you, which will tell you exactly what data we collected, and will also give you an opportunity to query or question that data if you want to. Also, the website is going to feature stories or testimonials. We really want to not only present the data, but also to present the human side of what is going on in drug policy around the world. So for each of those 30 countries that Maria showed you a moment ago, we are also looking for testimonials, people who can tell us their lived experience of drug policy in that country. And again, this will just allow the data to become more alive. It allows us to tell the story about, behind the numbers. The website will also include very detailed information about the methodology for those who really want to scrutinize the methodology, as well as all the information to contact us and to be involved in this project as it goes forward. Because as Maria said, what we're doing right now this year and launching on the 8th of November, that's really round one. And the benefit of doing an index is that the real strength comes when you collect data over time. Because then not only can you compare countries, but you can also see the trend within your country. So are drug policies in Kenya getting better or worse over time? And so it's our ambition to keep implementing the index in the future as well. And as Maria said, to keep expanding the index so that eventually, it's our dream eventually to be able to have this data available for every country, not just for the 30 that we have to focus on right now. As I said, there will also be a narrative report. It might look something like this. It's just a demonstration of what it might look like. But again, we really hope that report will be useful because it will tell the story of what is going on around the world in terms of drug policies. And as with any website, any good website designed nowadays, it will be fully functional on different devices. So if you're on your phone, a laptop, or a bigger computer screen, we'll make sure the website works for you. And again, just some examples of what it might look like once we launch it. So I'm going to talk a bit more now about some of that work that we've been doing for the last year, which is to design and agree this methodology. As I said before, with an index, the most important thing with an index is that it has this scientific presence, this scientific kind of visibility and rigor and strength. That's what gets it. That's why it's taken seriously by politicians. That's why it's taken seriously by the media as well. And in order to have that strength, you've got to have a very robust, transparent methodology. You have to make some difficult choices, but you have to document those choices and explain why you've made them. And as Maria said earlier, we've had to choose 60 or 70 indicators. We've had to choose 5 dimensions, and we've had to choose 30 countries. And all of those have been very difficult processes, and we've done it as best as we can. So as I said, in terms of the methodology, the frame that we're using in order to give someone 100 out of 100, the frame that we're using is the UN Common Position. Hopefully, we will be able to share a link to this document as well. But if you haven't seen the UN Common Position, I really do recommend it. I believe it's only available in English at the moment, which is a big weakness from the UN. But it is a very important document, and it really explains what the evidence tells us is a good, progressive, effective drug policy. So that's what we're using as our frame. And actually, more specifically, we're using a report that came just after the Common Position, which is called What We've Learned Over the Last 10 Years, a Summary of Knowledge Acquired and Produced by the UN System on Drug-Related Matters. So linked to the Common Position, the United Nations created this report which reviewed the last 10 years of data and evidence to show us what we've learned, what are the best drug policy options. And that's the document that we've used to get our indicators. Now, the other key thing that we decided, or one of the first things that we learned when we talked to other index teams and we talked to some of the civil society experts, was that there's obviously, and I'm sure this is the case in all of your countries, there's often a difference between what a policy is in law or on paper and what really happens on the ground. Those two things aren't always the same. And for that reason, with this index, we're not only looking at what the policy is in writing, but we're also looking at how it is implemented. So, you know, your government, for example, might support harm reduction in its policies, and that's great. But actually on the ground, there may be no harm reduction services or not enough harm reduction services on the ground. So the index that we've created, the methodology focuses on both policy and implementation together, because that's what's going to give us the best picture of drug policies. And finally, we're using a mixed approach. I kind of mentioned this earlier, but we're using data from different places. So we are using the UN data where it's available. We are using other academic data and databases where they're available, and that's all being centrally collected by our partners at Swansea University. But then we are also using a civil society survey to help us fill those gaps and to really get the understanding from NGOs in those countries about what is happening. So the survey the link is being shared with partners in the countries this month. You may have already seen this. You may have already had an email about this survey. It is being translated, so it will be available in English, French, and Portuguese to support you. And it's basically asking you a series of questions about drug policy. And we're asking you to give it a score from 0 to 4 to give your view on a question. For example, the question here that you can see on the slide, to what extent does arbitrary arrest and detention for drug offences exist in your country? Now, obviously, even within your country, so let's say even within Kenya, you know, Bernice, I think Bernice is on the call. Bernice might say that she might give this a 3 out of 4. And another partner from Kenya might say 4 out of 4, or someone else in Kenya might say 2 out of 4. So we understand that different people's perspectives will differ. So each question has a kind of more detailed explanation to make sure that everyone understands what we mean. But also, in each country, we're looking for at least 15 people, hopefully more, hopefully 20 or 30 people to complete this survey. And we'll be looking at the average scores because that will give us a nice picture of what's going on. So if lots of people in Kenya select 3 or 4, the average score will be somewhere around 3.5, okay? And at the end of the survey, we're also asking you to let us know who else in the country should receive the survey. This is called a snowball method. So we're asking you to fill in the survey, but we're also asking you to tell us who else we should send it to. And we'll keep that process going until we've got enough responses from each of the countries. And these surveys are going to really help us to kind of fill the gaps that exist and to help us understand what's going on the ground. And then, so Maria mentioned earlier the dimensions, and the way that we've divided this up is that we have around, I think the latest number is actually 75 indicators, and they're going to be divided between these 5 categories. So the first one is the use of extreme sentencing and responses, so things like the death penalty, life sentences, mandatory, long-term prison sentences, the real extreme end of the war on drugs as we know it. The second is going to be looking at the proportionality of the criminal justice system, and that will include things like decriminalization or alternatives to punishment. The third is looking at harm reduction and health and the public health response to drugs in the country. And the fourth one is also related to health, but we've pulled it out separate, and it's going to be looking at access to medicines. So access to controlled substances for medical use, for example, for pain relief, for palliative care, but also for opiate substitution treatment and things like that, for example. So, access to controlled drugs for medical use. The reason that we've pulled that out is that it's such an important focus of the UN drug conventions. the whole of the system is meant to promote the medical use, as well as fighting against any other kind of use, recreational use or non-medical use. The problem we've seen, and I'm sure you'll see this in your own country as well, the problem is that most governments have focused on the fighting part and have kind of forgotten about access to medicines. And so for us, it was really important to make that a dimension in its own. And the last dimension is on development. And this will include things like alternative development programs, access to markets for cannabis farmers, things like this. It doesn't necessarily apply to every country. So at the beginning of this dimension, there's a question whereby we ask whether development is an issue in that country. And if not, then those scores are omitted from the calculation. So now that we've created the methodology, we've agreed the indicators, and as I say, we're well into the data collection. We're almost finished now with the central data collection, and the civil society surveys are being sent out this month. So that's kind of what's happening right now in September, and by the end of the month, that process will finish. We'll then be analysing the numbers, putting it all together, but also weighting the scores. So, we have lots of indicators, as I said, but the issue with an index is, let's say, for example, a country has a needle and syringe program, which is functional. So that's a positive thing. But on the other side, they also have the death penalty for drug possession, or the death penalty for drug offences. So they've got one positive and one negative, but those two things don't weigh themselves out. They're different. And, I would argue that having the death penalty is a bigger negative than the positive of a needle and syringe program. So the weighting gives a slightly different focus on some of the different indicators, but it seem to be more important. So that's part of the methodology that we're working on right now. And all of that will then create the score, and will create the final scores for each country. For certain countries, we've already run the process. We've already calculated the scores, just because we want to check that the system works. And we're hoping that, ahead of this launch, ahead of the 8th of November, we will be able to share with you the scores and the data for your country, so that you can start to plan your advocacy around that. Obviously, right now, I can't tell you what the score is going to be for Ghana or what the score is going to be for Senegal, because we're still collecting the data and processing everything. So just a few slides before we stop for some more questions, just to show you an idea of what the website might look like. So as I said, when you first go on the website, one of the first things you'll see is the overall map. So this will tell you the scores for each of those countries. And just to repeat what we said earlier, please forgive us for having the Western Sahara not coloured in here. That will be fixed in the final version. And ignore the colours right now. Obviously, we've just made up some data in order to show you this. But this is what you'll see when you first go on the website. You'll see at a glance which countries have got the highest scores and which countries have the lowest scores. But then you'll also be able to see a map for each of those dimensions. Remember, I mentioned that there's 5 dimensions that we're using. So you'll see a map for each of those as well, if you want to see that. So if you want to just look at proportionality of criminal justice response, you can see the scores for every country that way. Same for access to medicines, for harm reduction, and for development, for example. So you'll be able to see it in a disaggregated way. You'll also be able to see it as a list, as a ranking from top to bottom. Again, ignore the numbers. We have made all of these numbers up just to show you what the website would look like. There is no way, as someone who's from the United Kingdom, I promise you the United Kingdom is not going to score 98 out of 100 in this index. Our score is going to be lower than that, I promise. But this will show you, you'll be able to see who's got the highest score, who's got the lowest score. You'll be able to sort it however you want, and you'll also be able to see the scores for the different dimensions as well. So again, we're trying to create an interactive website where you can manipulate it to see what you want to see. You know, you can see the data you want to see. And then each country will also have its own page, its own section, its own downloadable country profile, where you'll be able to see the scores that that country gets. And you'll also be able to see a detailed breakdown of the different indicators and the different results, the different data that we put into that system, as well as seeing the stories, the testimonials from that country as well. So hopefully that just gives you an idea of what this website is going to look like when it's launched. Maria, and we'll go through the next. Maria, do you want to try and take control of the screen, or do you want me to still click through the slides?
Please take control of the screen for me.
Okay, no problem at all.
Great. Okay, so thank you, Jamie, for that wonderful work. So we are now going to kind of turn to more of the advocacy components of the project. And like we've been saying all along, it's a preliminary discussion. And we hope that it's going to provide us with some kind of inspiration for the coming few months after it is launched and we have to engage at the national or regional level for our advocacy. But we also really like to hear more from you so that throughout the section, we'll have, I mean, if you have any feedback, comments, and questions, please feel free to ask and also get in touch with the team on that. To proceed, I want us to do a simple poll. What we'll do is we'll put our information in terms of the question I am asking on the chat, I mean in the chat box, so that, oh, okay. So we have the pool. So basically what we want to ask is for you to indicate who are your target audience in terms of this particular index when it is launched. Whom are you going to use this information from the index to engage? It could be the general public, the media, service providers, opinion formers, religious leaders, community leaders. I mean, it can be any range of persons, but we've just limited this in terms of the pool just to have an idea as to the people who will want to use this in engagement. So this is just for about 2 minutes, and after that we'll close the pool and we'll look at the discussion going forward.
Okay, thank you very much. The poll has ended, and
so someone
yes,
can you share the results?
Yes, I'm sharing the results now.
Wow, interesting. So from the pool we just conducted, we have 44% saying parliamentarians, 11% saying service providers, 22% saying media, and then 22% also saying the general public. So like I said, this is just a preliminary discussion just to have a fair idea as to how we intend using this data. So as you all know, our advocacy efforts generally will have to be tailored to the people we are aiming to influence. And from the pool, the simple pool we just did, many of you talked about legislators, some are talking about public, the media, and all that, because these are wide range of country represented in the index. And so, of course, I believe that it will be based on the data from your country and comparing it to other countries that will inform probably your target group and the people, or the score on the index that will definitely determine or inform the key advocacy targets who will be, you will want them to see this particular data. So based on your country experience and expectations, you can choose as many stakeholders you want in terms of the engagement process that you want to do. So, in looking at the data, you will want to look at, first of all, how your country scored. and looking at how your country scored, you will want to look at these scores and identify windows of opportunities that you can use this data to engage with policymakers for change, or the change that you want to see. And so, of course, the data on your country, and as much as possible, because you have other countries within the region, you will also be interested in looking at what are the scores for these countries. What are they doing right that my country is not doing right and not scoring as much as my country is doing? And like we rightly said, we're looking at this data in 4 dimensions. So there's a likelihood that your country can score for access to medicines or access to harm reduction services, but score very low in terms of the criminal justice system, the criminal justice system. So it is based on these scores and how they look like that will also definitely inform the kind of advocacy stakeholders you will select in terms of the people to engage with this index. Now, in terms of, I will want us here to also look at very key questions to consider, especially before you even elaborate on your advocacy plan. So like I mentioned much earlier on, what is your country score? How does it compare with the highest or the lowest score in the index? And how does it even compare with other countries which are within your region or outside your region? No, so in answering these questions, they will definitely give you pointers as to what kind of stakeholders you will want them to see this particular index. The next is also in terms of your advocacy work. Once you have your target, you have looked at the data itself and seen where you stand at the moment, you will also want to look at whom are you going to let see this particular findings or the score or how your country is performing at this material point in time. So what will be your audience? So from this simple pool that we did, you can see people saying that we need to engage with legislators because of course they at the end of the day are going to draft the laws and the policies. So of course it's important to lay this before them and engage them more effectively. You also talked about the general public. Of course, it is important the general public knows what is happening in terms of drug policy in your country and what they seek to also see happening in terms of legislations to address these key issues in the country. Now, one key other thing that you need to think around, especially in focusing around who are your target audience, is to ask yourself, do you have a good or a bad relationship with your target audience? That is not to say that if you have a bad relationship with your target audience, it should bar you from engaging with your audience. There are always ways in advocacy to be able to have that window or entry point to build that relationship and also use it as an entry point to engage with your audience. So that is why it's important that in the discussions around selecting your advocacy tools, audience and all that, you also begin to think about whom can I bring on board as an ally? Who are my allies? Why do we need allies? It is important sometimes to have very good, some allies when you are addressing issues of this nature, especially in terms of advocacy, because your allies could be very good in other parts. Like I mentioned much earlier on, whether you have a good relationship or a bad relationship with your allies, if in the event that you have a bad relationship with your audience, your ally, you could have an ally who has a good relationship with your government and can be an entry point to engaging with your government. And so these allies could be opinion leaders, they could be chiefs, they could be NGOs, they could be religious leaders, they can be government officials, the media, and all that you can think of. So it's important in this whole process that you think around these questions and begin to ask yourself these questions. And this is important because advocacy is always stronger if you have various partners joining the forces and in carrying out that work. There's a saying in my native language that a single broom cannot sweep very well. If you have them all tied together, then it makes the sweeping very beautiful. And that is very true. So if you have allies and you have partners who are joining forces to be able to do this more meaningfully, it helps to strengthen your advocacy, and it helps you to be able to go further more in terms of your advocacy. You also would want to also consider using the index data to reach out to other NGOs who are working on drug policy, or even focusing on related issues like maybe health, human rights, palliative care, those who are working in prisons, women's rights development, and many others. So you need to strategize and see how together you can jointly do this and advocate for the right policies to be used. Now, so the next thing I will want us to also look at in terms of the preliminary discussions, because we said these are all preliminary discussions just to kind of initiate and also motivate what we seek to be doing when the launch is done at the end of the day. There are other ways of these advocacies that can be done. They could just be social media campaigns, they can be public awareness raising, or they can even be face-to-face meetings, town hall meetings. They can be floats or rallies that will be organized to send out this information. And then, so of course, because we believe that transforming the data from the index into more of these components will help us to be able to reach out and be able to achieve and at least progress ahead in terms of its utilization. In terms of media outreach and public awareness raising, we believe that using these resources can be compelling, especially where you have human stories and some most important, which are part of this compelling data. And we believe that it will be able to reach out to a whole number or a whole bigger group that you will want to reach out to. And also depending on the context, it will also inform what kind of tool you will be able to use in terms of engaging. If in the event that you also want to kind of like maybe consider community mobilization protests, this could also work in a particular setting for you. So as I keep saying, it depends on your country situation. So community mobilization might work in my country, whereas it might not work in Senegal. So you need to look at the context where you think this is necessary and it will have a good relationship with, with the whole type of strategy you want to adopt. If you have a very good relationship with your government, then it will be good that you look out for government stakeholders and be able to use them as you go. And that is not to say that if you have a bad relationship, you can still not engage. You can engage, and as I said, sometimes when you have allies collaborating with you, it makes it possible to be able to do that. Let's also assume that you want to kind of like have some kind of like strategic meeting with governments. You can be using this data coupled with other personal experience to produce, let's say, a 2-page brief that could be utilized at a meeting with your government officials. That would definitely highlight challenges in terms of, let's say, Senegal, and how we can use this data to make it, to be able to advocate to mitigate these particular issues. Besides in-country engagements and interactions and all that, you could also consider regional advocacy gatherings. So you can use the data and personal experience to hold regional events, gathering with civil society partners. It can be government officials. It could be even neighboring countries. So for instance, Senegal, Nigeria, Ghana, Mali, Cote d'Ivoire can come together and have a regional discussion around drug policy and the options for reform, using some of the examples in country to be able to do that. You can also use this data to highlight, especially, I know a lot of us have UN countries, like UN offices within our respective countries. So for example, we have UNODC, we have other UNAs and other UN offices that are based in our country. So you can also use them to engage with these UN-related bodies that are in your country. Now, other related advocacy could also be at the higher level in terms of the global perspective of, for instance, the CND that is organized yearly in March in Vienna. We can actually hold such meetings where we can share this information, and also the Universal Periodic Review of the Human Rights Council that also holds sessions in Geneva to be able to do that. Now, just to add and say that we are in COVID, and I appreciate the fact that some countries have restrictions in terms of how we can engage. So of course, depending on your country's situation, it is important to also bear that in mind when you are organizing these activities, when the project is finally launched within that. Even if your country is not covered, like we've been saying, by the GDPI in this first round, as I mentioned earlier, and it is our inspiration that as we go along, we will be able to rope in more and more countries to be able to do that. So of course, you can still use it for your advocacy. All you need to do is at least check which are the best and worst countries covered by the GDP, see where your country might fit based on the indicators that you use, we use in the GDPI, maybe focusing on one of the dimensions only and how the GDP can be used to promote debate and reform within your country. You could also check the country scores in your region and draw some kind of like conclusions on how these could inform reform in your own country. And at least this analysis could then be used to meet with your government or with other stakeholders, be it regional advocacy that you are thinking or considering to do, then you do so. So like we rightly said, don't think that if your country is not selected, you cannot still utilize this particular advocacy tool. You can still look at these countries and the scores and how they are behaving in terms of the findings, and see where you fit in, and probably draw from that data to be able to use that to be able to engage at your country level. So basically, that is the inspiration we want you to begin to put you through, so that you begin to think around this and don't think that if your country is not part of it, you cannot utilize. You can effectively use this this tool. So on this note, I will want to pause so that Samuel can come in and pick up questions, and then we can address them accordingly.
If I may, Samuel, just to say, because I know that there's a lot of information today, and particularly for some of you who may be learning about this project for the first time. So our email addresses, both mine and Maria's, are on this slide. Please do just contact us at any time if you have any other questions, or if anything's not clear. I'm sure I'm speaking for Maria as well. We'd be very happy to answer your questions. And within the team, we have colleagues who can also help answer your questions in French and Portuguese as well.